Vomiting and diarrhea, actually we tend to see that a little bit more in the wintertime, although you can see it in the summertime as well. One of the causes of vomiting and diarrhea used to be rotavirus, which caused horrible vomiting and diarrhea. Kids were ending up in the hospital and in the emergency departments all the time. Fortunately, we're doing vaccines against rotavirus now, so that's much less of a concern during the wintertime, but we still have other germs that can cause vomiting and diarrhea. Again, most of the causes of vomiting and diarrhea are going to be viral in nature. They don't respond to antibiotics. In other words, we really can't do anything to make it go away any faster. So we kind of have to work through it. And so for vomiting, I'd say that any child that vomits more than 2 feedings in a row is probably going to need to have an alteration in their diet to address the vomiting. So I usually have people not give anything by mouth for at least 2 hours. Let the stomach settle. You know, you might have to put up with a little bit of crying, but you know, if you let the stomach settle a little bit and then go back to it with a clear liquid. So any liquid that you can see through, for most kids up until about school age or so, we only recommend small amounts of fluids for those first few hours. So I generally say 10 to 15 cc's or about a tablespoon of fluid every 10 or 15 minutes, and do that for the first few hours. And if we're able to keep that amount down, then you should be okay with increasing it after that. With diarrhea, if we are having diarrhea for longer than a week, if we're having any blood in the diarrhea, those are things that need to be seen by a pediatrician for the most part to just make sure there's not a germ that needs to be treated. Even some bacterial causes of diarrhea are not treated with an antibiotic. We actually just wait for them to get better on their own. You can address it with a BRAT diet, which is bananas, rice, applesauce, toast, starchy types of foods help out with diarrhea. There's a lot of evidence that probiotics can help out with diarrhea as well. So there are a lot of safe options out there for children for probiotics too. So for vomiting, the things that we would be concerned about is if you're doing small, frequent amounts of a clear liquid and you're doing that and your child still vomits even with that approach, then that's the point at which we say we really need to go ahead and take a look at your child and make sure that our hydration is okay and if there's another cause of the vomiting.